All right, it looks like the top of the hour.
Okay, should I start?
Sure.
Okay. Hello and good evening. My name is Ruby Alva de Hickson. I am a nurse practitioner who practices at the University of California, San Francisco. I have also the honor of being the policy chair for the National Association of Hispanic Nurses. I thank you and welcome you to this webinar. This webinar is hosted by Frontier Nursing University. This session is titled Hispanic Nurses Looking to the Future, the Journey of Becoming a Nurse Midwife. This presentation will share details and insights on what a career as a nurse midwife entails, the steps to advance your education and become a certified nurse midwife, what Frontier Nursing University offers, and the experience from a nursing perspective. The speakers will include Dr. Tanya Belchev, a certified nurse midwife and director of diversity and inclusion at Frontier, Dr. Lourdes Prince, a certified nurse midwife and regional clinical faculty at Frontier. We also have the honor of hearing from Emily Chavez, a registered nurse and current nurse midwife student at Frontier. Thank you and welcome.
Thank you so much. So Frontier Nursing University is the oldest and largest continually operating nurse midwifery education program in the United States. And we have recently updated our mission, though it's been very similar throughout the years, but our mission now is to provide nurse midwifery and nurse practitioner education that integrates the principles of diversity, equity, and inclusion. We transform healthcare by preparing innovative, ethical, compassionate, and entrepreneurial leaders to work with all people, with an emphasis on rural and underserved communities. So we offer 4 master's degree programs, which you could also have a postgraduate degree in any one of these. So nurse midwifery, women's health, family nurse practitioner, and psychiatric mental health nurse practitioner programs. And then we also have a postmaster's DNP program. In order to promote our mission, we educate nurses in their communities as much as possible. So we have an completely online distance learning program. But we do understand that a key part of educating nurse practitioners to be compassionate and ethical is to build community. And so we have 2 immersive sessions on campus. One is an orientation we call Frontier Bound, which happens before you start all your coursework. And then the second immersion experience is a week on campus, getting ready for your clinical rotations, called Clinical Bound. And these are times where you really connect with other students and with your faculty in a way that you can't do when you're in an online environment. But we do as much as we can to be connected even in our online environment. I want to personally thank the National Association of Hispanic Nurses for welcoming us to host this webinar today. And the Health Resources and Services Administration, also known as HRSA, has awarded Frontier with the Maternity Care Nursing Workforce Grant. And these funds are also being used to sponsor this webinar today, as well as Frontier's Office of DEI. The funds that we received for this grant are primarily earmarked for students, for student support scholarships and stipends, student support services like our student interest groups, and also working collaboratively with community consultants in order to improve our educational opportunities related to Latinx health. I would like to turn this over to Dr. Prince now.
Hello, my name is Lourdes Quinones Prince, and I am a certified nurse midwife. You might be asking, well, what is a certified nurse midwife? Well, a certified nurse midwife is an advanced practice registered nurse who specializes in continuing and comprehensive healthcare for anyone, for any woman throughout their lives, from puberty to menopause and beyond. We emphasize health promotion, disease prevention, and health education. Next slide. We are primary healthcare providers throughout the lifespan. We perform physical exams, prescribe medications, including contraceptive methods, order laboratory and diagnostic tests. We provide gynecological care, prenatal care, primary health care, healthcare education, and counseling to people of all ages. Next slide, please. Our professional organization is the American College of Nurse-Midwives. They are our national organization. We encourage all of our midwifery students to join. Once you join, they will email you with your regional meetings, the chapter meetings. And when you go to your chapter meetings, you meet nurse midwives in your community. Next slide. Okay, so now I'm going to talk to you about my experience as a Hispanic certified nurse midwife. I'll start with my journey to midwifery, my career as a nurse midwife, and my role at Frontier. My journey started with stories that my grandmother told me about her grandmother. These stories were about my great-great-grandmother, Monserrate Arroyo. She was a strong woman who reared 5 children on an 83-acre farm in Toa Alta, Puerto Rico. She lived from the early 1860s to the mid-1930s and kept busy juggling the roles of mother, wife, farmer, curandera, which is medicine woman, and partera, midwife. Monserrate took care of the people who helped farm her land and delivered their babies. She made use of simple herbs, water, and massage to heal ailments and decrease pain. Monserrate delivered all of her grandchildren. Her first grandchild was Rita, my grandmother. Monserrate had the respect, loyalty, and thanks of the families who she took care of and of whose babies she delivered. While our lives never overlapped, I felt connected to her, not only through bloodline, but through her spirit. I felt the calling to healthcare, particularly labor and delivery, after the birth of my first child. I went back to school and received an associate degree in nursing to go along with my previous bachelor's degree in psychology. After working as a labor and delivery nurse for 12 years, I felt a strong calling to become a midwife. Then I entered the midwifery program at the University of Florida. I wanted to do more to help women. I firmly believed in the continuity of care model to provide services for women not only in childbirth, but over a span of time and life stages, and to care for the people in my community. Caring for women over a span of time is the cornerstone of midwifery and aligns with what my great-great-grandmother did. Okay, so as a new certified nurse midwife, I started by working in a full scope private practice, and I earned my sexual assault nurse examination certification. I was on call every 3rd night for deliveries and every other night for sexual assault exams in 2 counties. And I did this for 4 years. I loved this job, but the 70 to 80-hour work weeks were hard on my family. In search of a better work-life balance, I joined an OBGYN faculty practice with Orlando Health in Orlando, Florida. At Orlando Health, I supervised first-year OBGYN and emergency medicine residents with normal labor and birth, and I precepted nurse midwifery students and women's health nurse practitioner students as well. In my 24 years of midwifery, I estimate that I have delivered a little over 4,000 babies. Now, after precepting nurse midwifery and women's health students for 24 years, I joined Frontier in May of 2023 as a regional clinical faculty for midwifery and women's health. I had colleagues who were RCFs with Frontier, and they felt that with my many years of clinical experience and my experience precepting students, I would be a good fit. So basically, my passion for precepting students evolved into joining Frontier as an RCF, or regional clinical faculty. Now, my role as an RCF involves supporting graduate students throughout their clinical journey. I advise, support, educate, and evaluate the clinical students. I meet with those students every 2 weeks or more often, if needed, to orient them to course expectations and create a social, cognitive, and teaching experience. I maintain contact with their preceptors each month and offer support to ensure the best clinical experience for each student. New slide, please. Okay, now I would like to take a moment to talk about the importance of racially concordant care, because there is much to be said and to be concerned about when it comes to racially concordant healthcare as it relates to the Hispanic community. Lack of access, lower socioeconomic status, and language barriers prevent many members of our community from seeking care. The United States is not designed to meet the needs of the Hispanic community. Not only are services often out of reach, but and that this can be due to lack of insurance or proximity to these services, but they are often not culturally or linguistically tailored for this population. Although access to interpreters is something that's required, Hispanic patients who do not speak English often have to rely on family, friends, or other untrained individuals as interpreters. Addressing disparities in healthcare among the Hispanic population is particularly important when it comes to midwifery care. This is highlighted by the fact that the Hispanic community in the US faces significant health disparities, particularly with higher rates of obesity, diabetes, hypertension, and chronic liver disease, which can lead to pregnancy complications. Hispanic mothers are also at greater risk of dying from infection and hemorrhage compared to other racial groups. Midwives, as licensed healthcare providers, play a crucial role in improving maternal care, leading to better outcomes and patient satisfaction. New slide, please. Of concern is that Hispanics are not adequately represented as providers in healthcare. For example, according to the 2020 census, Hispanics represent 18.7% of the US population, yet only 5.6% are registered nurses, 5% are nurse practitioners, 4.7% are certified nurse midwives, and 6.5% are physicians. Let's compare this to, let's go to the next slide. According to the 2020 census, 14.5% of the US population identify as Black or African American, and a higher number, 6.7%, are registered nurses, 8.1% are nurse practitioners, 6.8% are certified nurse midwives. So all those first three numbers are a little higher than the Hispanic population, even though they represent less of the total population. And then 5.7% are physicians, which is a little tiny bit lower than the Hispanics. Now let's compare this to the white population. The 2020 census states that 61.7% of the US population identify as white, and 80.6% are registered nurses, 79.4% are nurse practitioners, 85.4% are certified nurse midwives, and 64% are physicians. So as you can see, they are overrepresented in the healthcare field. Next slide. Let's see. Advancing health in the Hispanic community can be supported by increasing the number of Hispanic providers who will become a part of those communities. A diverse workforce understands that the language, culture, issues, and needs of the local patient populations can provide a deeper insight that results in better decision-making about how to serve those communities. Those decisions then have the potential to positively impact patient experience, safety, quality, and the community's overall health. Next slide, please. Okay, so Frontier's Nurse Midwifery Program. I'm going to talk about why choose Frontier Nursing University and how do you become a certified nurse midwife. Next slide. Registered nurses looking to advance their careers should consider Frontier Nursing University for its exceptional midwifery program. Founded in 1939, we are the oldest and largest continually operating nurse midwifery education program in the United States. We graduate more than 40% of the nation's midwives. Additionally, Frontier has been a leader in distance education since 1989. That is before we even use computers in the classroom. Frontier Nursing University offers graduate nurse midwifery specialty track that can be pursued full or part-time while completing a Master of Science in Nursing or a postgraduate certificate. The flexible online learning format allows for a balance between work, study, and personal life, while the hands-on clinical experiences prepare graduates to provide high-quality, culturally competent care. Our faculty is large and diverse and represents a vast amount of clinical and educational experience. More than 50% of Frontier's 150 plus faculty are certified nurse midwives. Frontier is a national leader in diversity, equity, and inclusion. A culture of caring is shared by the Frontier community, and this is built on professionalism, inclusivity, respect, positive communication, and mutual support. By creating a culture of caring, students, alumni, faculty, and staff enjoy a committed and loyal community where all of us feel valued, confident, empowered, and accepted. We embrace this culture to fulfill our full potential, individually and collectively. Together, we exemplify the caring behaviors we hope to bring to the wider healthcare system. With a strong emphasis on rural and underserved healthcare, a rich history of midwifery education, flexible scheduling, scholarship opportunities, combined with our caring community, Frontier is the ideal choice for the passionate Hispanic RNs who want to make a difference in their communities. New slide, please. So the admission criteria is to be a registered nurse with a current active license in the U.S. and educational preparation from a CNEA, which is the Commission for Nursing Education and Accreditation, ACEN, the Accreditation Commission for Nursing for Education Nursing, or CCNE, Commission on Collegiate Nursing Education. So it has to be one of those accredited nursing programs with accreditations current at the time of your graduation. Students must meet the licensing requirements for the state where they will do their clinical rotations. Also, you must have 1 year's nursing experience. All right, I'm going to turn it over to Emily Chavez. She is Frontier's midwifery, one of Frontier's many midwifery students. Thank you.
Hi, my name is Emily. So I wanted to talk a little bit about my experience so far at Frontier, at being a Hispanic nurse midwife student. So one thing I noticed was being part of this university, I have been recognized for being Hispanic and I have been acknowledged for being Hispanic. And this is the first time I have been experiencing this. When I did my undergrad degree at a smaller college near me in New Jersey, I was one of the very, very few Hispanic nurses or student nurses at the time. There was very rare diversity in that school, and I never felt part of the school, if that makes sense. So it's so nice to be part of a school that recognizes my ethnicity and acknowledges it. And it's the first time I truly felt part of the school and I felt like I belonged. I believe prior, one of the speakers did mention about the two on-site visits that are done, and the first one's at the orientation, and the second one is clinical bound before starting clinicals. And I'm so grateful for both of those experiences because at each experience, I had such an amazing time and I had a true feeling of like, this was the right decision. This was the right school. And I'm so happy and so grateful for Frontier and how their program is set up. I do have so much support from the faculty, especially from my RCF. They are so hands-on and I don't feel I'm alone. I mean, I was terrified to start clinicals, terrified, and I never felt alone throughout this whole process. And that's like another reason why I'm so grateful for this school because I'm recognized as being Hispanic. They acknowledge me and then they support me. And especially the times where I feel like personal life and working full time and being in school full time, sometimes it's a lot that's all going on at once. But having that support, and it's like an amazing community. And I can't speak greater than the school. I highly recommend the school. Another thing that the school has, they do have the Latin student interest group. So it's every month there's a meeting. I believe it's every Tuesdays, and they kind of just talk Hispanics and talk about what's going on. Each student's at a different point in the program, but it's a great way to interact with other Hispanic students, which is amazing. So I do have a personal story about caring for Hispanic patients in labor. So I'm currently in my clinical aspect of the program. I had a patient a few weeks ago when I came onto my clinical shift around 7 a.m. When I came on, I arrived and there was a Hispanic patient. It was her first pregnancy, first baby, and the doctor was very adamant about her getting a C-section. The patient only spoke Spanish. The doctor did not speak Spanish and was not using a translator appropriately and just kept saying, well, she's not pushing good. She's not pushing good. We're just going to do a C-section. And I looked at my preceptor and I was like, can I please try and see if I can be of any help? So I went in the room. The patient was very uncontrollable in the moment. She was feeling a lot of pain because they had her epidural turned off and she's like, I'm not understanding anything of what's going on. So I kind of had to talk to her. And I was like, okay, this is what's going on and let's try and fix it. But we're going to work as a team. And I was able to kind of calm the situation because the doctor was very adamant about having a C-section for her. And she was just not knowing what was going on. So in that moment, because I speak Spanish, I was able to talk to her and we were able to push and have a vaginal delivery. And it was amazing. I was so proud of her. And then I told her, I was like, it was hard work. It was not easy, but it was amazing. And she did it. And it was in that moment afterwards when she was crying to me and thanking me in Spanish and being like, I wouldn't have done this without you. You have no idea how much I appreciate you for all your guidance and all your help because I felt so lost without you. And just having someone to speak Spanish and speak up for me, it means everything. Thank you so much. Like I can't thank you enough. And I practically left a room with tears in my eyes. And that's when I realized I'm like, okay, I know I'm doing something good. So it's amazing to be part of this school and to feel like I'm actually making a difference. And even if she doesn't remember my name, she remembers how I helped her in that moment. And I feel like that's so important. And I work where I'm doing my clinicals, it's a community that is mostly Hispanics and African Americans, and they're minorities. Probably close to 95% of all the patients there are minorities, and making a difference. And when you just walk in a room and you see a patient and you say like, hi, good morning, and they just kind of smile at you, and I'm like, do you speak Spanish? Is Spanish better? And then they just have like a sense of relief, and you can just see it on their face automatically, and they're like, oh, you speak Spanish? Okay, I'm so happy you're here. I mean, giving birth is a very vulnerable time, okay? And it's scary, it's nerve-wracking, it's exciting. There's so many emotions going on. And being able to communicate with the patient in their language makes such a difference. And it's in moments like those, with that story that I had with this one specific patient, it kind of just validates everything. And I'm like, every night that I'm studying late, sleepless nights, all those tests that I take, I'm like, it's so worth it. Because especially with this one moment when I'm like so proud of myself, because I'm usually hard on myself, but being so proud of myself in that moment and knowing I made a difference today. And I was so proud of myself, and my preceptor was so proud of me. And I'm just so happy for that patient that I was able to communicate with her in her language and have a successful vaginal birth, despite a doctor wanting to push for a C-section. So it's very rewarding. It is hard work that gets put into this program, of course, but it's amazing, and it's so worth it. Moments like that made it so worth it, because a lot of Hispanics don't have a provider that speaks your language, or they're shy to speak up about something, about a problem, about a worry, because they don't know how to communicate. So it's amazing for this program to be so supportive of midwives, as well as they do offer scholarships, which I have been very grateful to be rewarded some scholarships throughout my time here. And it's truly an amazing program, especially for Hispanic nurses that are looking into it. I highly, highly recommend Frontier. Thank you.
Thank you so much for sharing your story. What an inspiring story. I just wanted to emphasize that the 1 year of experience that's required for application is not required to be in labor and delivery. Any nursing experience you bring to midwifery contributes greatly to your career. So if you have ER experience or ICU experience or med-surg experience, all of that is valuable experience. And we have, the grant has, part of our grant, we've done a labor skills workshop to fill in the gap for people who don't have labor and delivery experience prior to applying to become a nurse midwife. So it is doable. You can do it. It is hard work, but very rewarding. Are there any questions? You can either put them in the chat box, or you can turn on your camera or your microphone and share.
Hi there, Emily. I want to say thank you just for your bravery in taking on becoming a nurse, a certified nurse midwife. As a Hispanic Latina going through school and being the only one, here you are supported. And just knowing that you have the power to advocate for your patient. Not only are you going to be granted advocacy for your patient, you're going to be advocating for your profession and for the Hispanic community. As somebody from the Hispanic community, I thank you for that, because of course, provider concordance is so important. When people see you, it's almost a relief that maybe we can connect. And it's not to say that other people cannot connect with that patient, but there's just some bond knowing that they feel relief that you are there. And I say thank you, just for taking on that profession. And I just wanted to remind you of Maya Angelou's. She did a quote, and it's beautiful what you said. I've learned what people will forget what you said. People will forget what you did, but people will never forget how you made them feel. So I just wanted to say thank you. And your story is inspiring. I, as a nurse practitioner for over, and a nurse over 25 years, you make me want to come back to school. And I just finished a DNP. And just your just enthusiasm and your appreciation for this school. It really shows. Thank you.
Thank you so much for those kind words. I really appreciate it.
There is a question in the chat box about how long the timeline for the program. And we do have a part-time or full-time options. So it's approximately a 2-year program, but it can go a little bit faster or a little bit slower depending on the track that you take. And as a part-time student, how long does it take to complete the degree? That, I guess it depends on your program of study. Sometimes clinical rotations have some impact on your graduation time, but it can approximately 3 years. You go.
Five of those, and I got 3 of those, and it's kind of a headache because I remember to take these to the garage, the oil changes those, and and I gotta have the pool, make sure the pool man's doing the right thing, and I gotta.
Any other
That's
questions?
my money. I'm worried about whether or not he's gonna be. There's so.
Oh, once obtained, do most CNMs work in the hospital setting or office setting? The beauty of midwifery is that there's many, many options. So some nurse midwives work in out of hospital community settings where they do birth center birth or home birth. Some will just be a hospitalist and do OB triage and catch babies only. And some will do, like Dr. Prince was saying, full scope practice, which means you see the patients in the office, you do GYN care as well as full pregnancy care, and then catch the baby at the end of the prenatal care. And is there anything you'd like to add to that, Dr. Prince?
Oh, no, basically the first 4 years I was doing full-time office Monday through Friday and taking a lot of call. And then with the job with the faculty practice, I was basically a hospitalist where I worked mostly in the hospital, but also we had some office hours as well. But it didn't exceed 40 hours a week. So that was the beauty of that practice. And I think most practices are trying to do something similar. I think the days of 70 to 80-hour work weeks are gone, thank goodness. And they do try, to keep you within that 40-hour range. So if you're in an office-based practice, you may only do 3 office days a week and then take a certain amount of call so that you're not overwhelmed with so many hours.
Does Frontier offer dual master's programs for the CNM? So we don't at this time, but you can, after you complete one master's degree, like to get a postgraduate certificate, say in family nurse practitioner or in psych, it would just be an additional year of study. So it's not quite dual degree, but it is abbreviated. And the application process, it's not too lengthy. We do require an essay that's focused around our mission and vision. We want a current resume that's like graduate degree seeking focus, so it doesn't look like a job resume, but like actually that you're applying to school. We want to see that your license is current and unencumbered. We look at your previous grades. We currently like a 3.0, if you made less than a 3.0 for your grade point average, we do a special review process, but we have holistic admissions. So we look at the whole picture. Did you do volunteer work? What other kinds of community work have you done? Presentations, any research, things like that.
We do have some nurses without L&D experience who were doulas, and that definitely counts as well. Or certified childbirth educators, certified lactation consultants, paramedics, or public health experience. And we even have a previous licensed midwife who went back to school for her RN, and now she's doing the midwifery program.
We also do rolling admissions. So we're not everyone, you can apply for a fall term, a winter term, a spring term, or a summer term as your start date. And our terms are 11 weeks long. So they're sort of fast and furious. That's the way I look at it. Like it's a lot of material in a really short period of time. But the nice thing about the short period of time is that just when you feel like, oh, I can't take any more, the class is over and you're on to the next class. So it's really good.
This is Tiffany Melvin. I asked the previous question in the chat, so I didn't want to have to type a long question, but I've had my bachelor's degree was online. So I'm just curious about the setup on the online programs. There's some schools that, you go in and you do all your work, everything is laid out on your syllabus or whatnot, and you complete your assignments, turn that in, and then you're done. Some are more based on, I guess, discussion posts and things like that throughout the week to keep communication going and stuff. So how does Frontier do as far as online learning?
We are because we're so committed to community, we are very do expect a lot of engagement with the course material. So and it varies from course to course, but there are discussion groups. We do a lot of simulation, even though it's online, we do simulation online. Emily, do you want to speak a little bit more about the coursework?
Yes, so it does kind of vary with each class. You always will get a syllabus ahead of time. Some classes do have like the simulations, and some classes you sign up for the simulation. So usually it's okay, like these are the days and these are the times, and these is like weeks and weeks in advance. I mean, practically like 2 months in advance. So from way before, you kind of schedule what day and what time works best for you. And then even if something were to happen, you can also like reach out to other students to see if someone can switch and swap with you. But in terms of like assignments and tests, usually most of the classes that I can remember, there are tests that are scheduled, or they're scheduled, okay, it has to be done by Sunday, 11:59 p.m. And they open from 6 days before. So you have like a 6-day time frame up to take the test, if that makes sense. That's usually how it's set up with like the classes. So from ahead of time, and there's only a few times that there's something scheduled for a certain date and time, and that's like the simulations or like discussions, but that gets scheduled from before, and there's different days and times. So you can pick what date works best for you. And then if something were to come up and you're not able to do that date or time, there's always ways to like reach out to another student to see if they can switch with you.
Thank you.
We try to be as flexible as we can while remaining rigorous in the education. We have really high pass rates for boards, some of the highest in the nation. So, you know, that dedication to rigor is really, we keeps getting reinforced, right? Like we're like, oh, good, everybody's passing. We also offer something that other universities don't offer, which is a comprehensive review course at the end. So you don't have to pay extra to take a course before you take your boards. And that is really helpful. It's only a 1 credit course and it doesn't count towards your like whether you graduate or not for it, you know, passing it. It's really a bonus that we'd like to offer for you to help you get ready. Any other questions? Please feel free to reach out to any of us at the university. You can reach me through diversity-inclusion@frontier.edu, or we have probably admission. Is it Quincy? Is it admissions at frontier.edu for questions?
Yes.
Okay. Ruby, thank you so much for being here tonight.
Thank you for having me.
And we look forward to the next generation of nurse midwives coming our way. Oh, is there another question? Are there courses and semesters or specific week sessions? So there is a program of study. So we usually have people do their pathophysiology, their pharmacology, and their physical assessment first. That's kind of the foundation that gets laid. And then there are different prerequisites along the way. You in the pathophysiology and the physical assessment and the pharmacology class, you're actually mixed with all the programs together. So it's not separated by midwifery or family nurse practitioners. You're all working together, and then you separate out into your program specific work. Does that answer your question?
Is it okay if
And
I
then-
add to that?
Yes, please do.
So usually we call them like terms instead of semesters. So it's like 11, 12 weeks of the class, and then you have off for 2 weeks. You get like a 2-week break, and then another set of like 11, 12 weeks of the class, of a different class. So usually it's instead of like the usual semesters, like fall semester, spring semester, like we're used to at like a 4-year college. It's more like terms that we have. So it's like a fall, winter, spring, and summer term. Each term is about 11 to 12 weeks. And then you have like a 2-week break in between each term.
And then I think another thing that's important to know is that you are responsible for finding your own clinical sites, but we do have a clinical outreach and placement department that is very helpful in helping you make a plan of action for finding your sites. Some people, when they come into the program, they were encouraged to come by a nurse practitioner or a nurse midwife who saw how wonderful you were on the floor as a nurse. So they may be ready to be your preceptor when you're at that point in your education as well. Some people do travel to get their hours or their births in a little bit further from home than maybe they were expecting to. But it adds to the richness of your experience when you can see other ways of practice. Sometimes when you're in a small hospital, if you're in a small rural hospital and you only do things one way, it might be nice to like have a experience somewhere else to see the good and the bad that you would like to, the good that you would like to bring home and the bad that you would like to leave there. You know, because we all have different ways of practicing. So some students will go part-time and take one class at a time, and some students will go full-time and take, most students don't take more than 2 classes at a time. About 6 credits. You know, a few people will take 9, but that's a lot. Like I wouldn't recommend working and taking 9 credits at the same time. There are times during the terms that you have to travel to Frontier. So just before you start, you go to Frontier Bound. That's 3 days, I believe, on campus, where you get oriented to all of the aspects like the library and all the services that we have on campus, as well as how to access Canvas, things like that. And then you finish all of your didactic coursework, so all of your academic work is done, and then you go for your clinical bound term, which is 1 week. Once you go to clinical bound and get all your checks marked, then you can start at your clinical rotation. So some schools will intersperse clinical throughout, but we do it all at the end. So once you finish all of your coursework, then you go to clinical, and you just if you apply now, you'll be doing 750 hours of clinical time. And you just do it all in a row, and you won't have extra classes to take, but you will need to stay engaged with your regional clinical faculty, which is what Lourdes is, or Dr. Prince is doing. And there are some assignments that she can speak to.
Yes, during your clinical time, you need to keep track of your cases and your time. So you'll see that you'll need a certain amount of antepartum patients, new OB patients, labor management, deliveries, GYN, peri and postmenopausal care. And so when you do your weekly case logs, those are your visits, your visit types. And then you also need to keep track of your time, because I guess as of this January, it's 750 hours. So you have to complete that amount of hours. And then with that, there are other assignments, such as reflections every Sunday night. And there are other assignments as well, a case attendance. We have case days where students review cases that they've had. And that your first assignment is to just attend a case and just write a little reflection paper on one of the cases. And then further on in clinicals, then you have to present your own case. And there's some videos, and there's some simulations that we do with medical schools that are later on in during your clinicals.
Well, you're gonna hang out much longer, I think. It's not.
They're all very good questions. Thank you. Do we have any labor and delivery nurses here tonight?
I'm not a labor and delivery nurse. I actually started out in pediatrics when I became a registered nurse, and it was under the same management as the labor and delivery nurse manager. And so I was kind of promised that I would get over there in that area, but never transitioned over there. So I wound up leaving that hospital a few years later, and I did get in a role of labor and delivery, but I got sick and I had to get my gallbladder taken out. And so I wound up leaving that hospital because of my sickness. And then I transitioned into public health nurse, but I really loved the labor and delivery, and that was my true reason for becoming. I said I'm gonna flip a coin. I either deliver animal babies or people babies, one of the two. And it came up with people babies. So, and I said I know I just want to deliver somebody's baby, but that was my true reason for becoming a registered nurse. And so I have been procrastinating because I graduated nursing school in 2009, and I've been procrastinating and coming up with all other areas of nursing to work in, and have not like truly fell in love with the ideal as much as I know that I will if I follow my destiny to become a nurse midwife. So I think I seeing this workshop online. I'm not Hispanic, but my son is. His dad is from Honduras, and now our household is a immersion of we have Hispanic, we have a Honduran, we have Mexican, and then me, African American. So we have a big melting pot here inside the home that and everybody is amazed when I start speaking Spanish to them. I'm like Emily when I was a nurse in pediatrics. A lot of people would come in with their children, and of course they couldn't speak, English. And I soon learned to speak Spanish and became very fluent. And that sigh of relief when people see that you are able to speak to them and are more compassionate versus someone, not to say that the English speaking nurses weren't being compassionate, but it's hard to show that same compassion when you aren't able to understand what someone is saying to you. So I totally could relate with that story that she was saying. And I think this was my final confirmation. I was like, oh, what is this workshop? And it says Hispanic. Okay, I'm not Hispanic, but I'm gonna sign up for it and see what they're talking about. Maybe that'll give me a little bit more encouragement to do what I need to do. And so this is my final confirmation. I just was like, tonight you need to get online and figure out what it takes to apply, and just, follow your destiny. Sometimes you just need to follow your heart and do what you think that is really what you desire to do. So I really appreciate all this information tonight.
That's wonderful. That fire and your passion for it will never go away. So I really do encourage you to come to school, and it's never too late to come to school. I know a nurse midwife who she was 50 years old when she went back to school, and she did her last 10 years of her work life as a nurse midwife, and she had more energy and enthusiasm than anyone I've ever met. I think she never walked, she always ran. She was so excited. So I really look forward to you launching your career as a midwife. Anyone who doesn't have labor and delivery experience who's worried but really would like to do it? Can we give you a little encouragement? Well, not hearing any more questions. I really, really appreciate your time tonight. You all stuck with us through this, and it is the best job you will ever love. So don't hesitate to reach out if you have any questions here. I will also put my email address. Actually, I'll just put my personal email address in the chat box if you have questions. There you go. Feel free to contact me. Thank you.
Thank you. Good night, everybody. Buenas noches.
Buenas noches.
Good night.
Good night. Thank you, everyone.
Good night. Thank you.